Good morning, everybody. It's Angela from Affinity, and I am here this morning with Rochelle, our amazing PA. Say hi, Rochelle.
Hi.
And our gorgeous client, Josy. And
Hello.
we decided to do an impromptu kind of video today. As some of you know, we put out our video the other day about our flash sales. We've got our flash sale going on, and Josy had commented on one of the posts, I can't wait for you to see my Morpheus results. So we asked her to send their pictures. It's a little early. We're always jumping the gun on people's after pictures. We can't really wait until after. We want to see what you look like in a week. And Josy's just a week out from her Morpheus 8 treatment. And we were so excited when we saw our pictures yesterday. So we thought we would answer some questions today. I know the main ones that everybody has are, does it work, does it hurt, and how much does it cost? We'll do just a little more than that today. We can start, Rochelle. I'm going to ask you to tell us what Morpheus 8 is. Now, Morpheus 8 is fairly new to Affinity. This is something we've acquired pretty recently. It is not new to Rochelle. She's worked with it before at her other plastic surgery center. There was actually a training center for Morpheus 8. So while it's new for us, it's not new to her. So can you, in just kind of layman's terms?
Yeah, so Morpheus 8 is basically microneedling, but with radio frequency. So essentially these microneedles go into the skin, and at the tip, it emits radio frequency. And what that radio frequency does is help heat up the dermis, and in turn stimulates collagen and helps really tighten the skin. It also helps repair any texture issues such as acne scars. It helps smooth out wrinkles, and it's safe on all skin types because it heats up the dermis on such a deep level. It doesn't affect your melanin production.
So that's big for those of us with darker skin types, that it doesn't cause that post-inflammatory hyperpigmentation that some of us worry about, right?
Yes, exactly.
So Josy, you found Affinity kind of by accident not too long ago. Can you tell us how you found out about us?
I think it was a 80s party that you guys, promo party that you guys were having outside the studio. I recently moved to Waterford Lakes, and we like to take long walks in the afternoon. And we heard fun music, and my husband was like, let's go walk and see what's going on. And that's when I met you guys.
Perfect. We're so glad you did. We've had a wonderful time welcoming you to the Affinity family. So you recently had a Morpheus treatment. Can you tell us why you wanted to have it? What skin issue were you trying to treat?
Well, when I came by for my Christmas present, I asked my husband that I wanted to do laser treatment for my face. I've had pretty severe acne when I was in high school. And, you know, while I don't have acne anymore, obviously we had the results of having acne scars on my cheek. And, you know, I've spent a lot of money and time using all types of products to help resolve the texture issue, because that's really, you know, a texture issue with my skin. I also have very large pores. And so when I met you guys, and, you know, we met at this 80s party, you guys had a sale going on, and actually my journey started with the Halo treatment.
Yes, mine too.
Yeah. and I love absolutely both of those treatments. And I was commenting with Rochelle that each one of those treated different things and problem areas in my skin. Right. So the Halo, I felt, was really effective at minimizing the size of my pores and plumping up my skin, getting the fine lines that I was starting to get. You know, probably from makeup overuse, or, you know, all types of things young girls do. And so I think that the Halo was excellent at helping me treat that. And then the Morpheus really just smoothed and enhanced all that work that the Halo did. So I think that layering those two together was like the perfect combination from my skin. And I mean, if you guys show the before and after photos,
yes, we will. Yeah,
it's very significant.
We will. And that's what's really exciting to us is, you know, at Affinity, we really want to under-promise and over-deliver. So when we do that and do it really well and we get a home run, that's really exciting. Now, you're just a week out from treatment. I'm 3 weeks out from treatment. And we took my after pictures at the 2-week mark and saw significant results as well. But really that 3-week mark is when everybody says, you know, that's kind of when the magic really starts to happen. So you're not even there yet. And Morpheus, unlike Halo, which is, you know, kind of a one-time treatment, Morpheus is best done in like a series of 3. So you haven't even gotten to like peak results yet, and you're already thrilled, right?
Yeah, I already told Rochelle we have to schedule my second session.
Ready? I'm ready too. So let's talk about the couple other questions. So this is a procedure that you're going to want to meet with Rochelle first and do kind of a post-op appointment, talk about expectations, healing time, stuff like that. We're going to talk about that a little bit now. This is a treatment that you numb for, correct, Rochelle?
Yeah. So you numb for about 45 minutes pre-treatment. And I'll usually go over a week before certain medical questions. We'll go over medications, settings, expectations, and all the information that's pertinent. All your skincare for afterwards too, which is really important. So.
Okay. And I know as far as pain level, everybody has a different pain level. I am the biggest baby that we have in our whole entire clinic. And it was a little ouchy for me. I will have to say at the 2-week mark when I saw my results, I was like, oh, I don't care. Do it again. I'll whatever I have to do to get through it. I'm so impressed with the results. So tell us about your experience having the actual treatment done, Josy.
For the Morpheus specifically?
Yes.
So for the Morpheus, obviously your face is completely numb, and Rochelle did a really great job making sure that my face was numb. And she made sure to, thoroughly cover my entire face with the numbing cream and left me there for quite a few minutes to make sure that I was at the best level of comfort that I could be. In terms of, pain level during the session, it felt like I would compare it to like when you have like a little rubber, like when you sting a little rubber band on your skin, it's like a little, a light stinging sensation. It was manageable for me. The areas where it was maybe a little bit more like, was during the bony areas on my forehead, but like where I wanted her, the concentration of the treatment to be was where the chubbiness is. So we're fine. It was totally manageable. I mean, another, really, I have like these grumpy, I call them my grumpy wrinkles, which is like the 11 that shows up here when I
little Botox next for you.
Yeah, we need that next.
but even then, like if I relax my face, like they're not permanently there anymore like they were before, because my skin has kind of filled out in those thinner areas. So
yeah, I'll have to echo what Josy said too. It's interesting for me. And I didn't even realize until I saw my before pictures that this is my area of I didn't even think my neck was an issue until I saw my before pictures and I have this little thing. Then when I saw my after pictures, it's significantly tightened. I will have to say on the jawline and the neck,
yes,
I think are big areas of concern
for a lot of people.
For a lot of people. It was super easy for me. And
the neck, they say, isn't as painful, so that's good.
And it does the pain only. It's not like if you feel that little rubber band, snap back and then it goes on for hours. It's just that little snap back. What was your after like for day
my
after?
Recovery for the Halo? It was significantly longer because it's there was a lot more swelling with the Halo, so it took me a few days to recover. But the Morpheus, I had maybe maximum 1 day of a little bit of swelling in the areas that she focused on, but it wasn't and I was still out and about doing my errands and was able to work, and I didn't have any crazy bruising or anything like that. I got maybe like one little little tiny dot here, which is
around the eyes is super common for bruising.
Right. It was very small, very little. The skin tint. That's what I've been using. This is like the first time. I love that thing.
Yeah.
I just put a little bit of that, went to the gym. No one ever asked about it or even noticed it. The downtime with the Morpheus was really, really short, which was surprising because of how much improvement I saw in my skin. Even my husband, who of course always, is supportive of my crazy skin adventures. But even he, like I think it was like 3 days after, he woke up and he's like, babe, your skin looks really good. And I'm like, that's when I knew.
Money well spent.
Yes, we love it when the husbands and the boyfriends notice, since they don't always notice things like that. That's great. So Rochelle, who is a candidate for Morpheus and what kind of things can it treat?
Um, Almost anyone's a candidate. It doesn't matter on skin color. You can do the palest of pale, the fairest of fair, and the darkest of any skin color. So everyone's safe. There's certain contraindications such as like metal plates in the face, which is not super common. So if you've had any major surgeries and you have any metal screws or plating in the face, you're not a candidate. But almost everyone else is. So that's what we go over in your pre-op appointments anyway. So.
Okay, so anybody who has acne scarring?
Yes, anyone with acne scarring, especially people with any kind of skin laxity in the neck and lower face. That's really big. People who are like, I don't really want a facelift yet, but I could get some kind of tightening effect here. That's where this is huge. And, someone doing like a series of 3, they consider maybe continuing doing maybe 1 a year just to maintain results. People always ask, how long does this last? It lasts as long as your body isn't aging, because it's your own body's healing mechanism and your own body's collagen that it's laying down. It's not like we're injecting something that's semi-permanent. So as long as you use good skincare and you practice, safe sun exposure and things like that, you're going to maintain your results.
Right. And one of the things that we do too in either our consults or on our pre-op appointments or things like that is we talk to you about skincare nutrition. Make sure your vitamin C intake is adequate. That's kind of the precursor to collagen in your body. So that helps a lot when you're doing these collagen induction therapies, things like that. Just healthy diet while your skin is producing all that collagen.
Absolutely.
So yeah, it's one of our favorite new treatments at Affinity.
Mm-hmm.
All of our treatments at Affinity are born out of need. Either something that somebody on the team is like, oh, I really wish I could treat this on myself, or we start hearing from clients over and over. It's how we got our melasma peel. We just got tons of melasma clients coming in. And for this, we got clients who had acne scarring and had, especially skin laxity around the eyes, under the neck.
Mm-hmm.
We just started searching what's the best answer for this for our clients. And Morpheus 8 certainly was it. We're really, really loving it. We do have some specials going on right now. We will post the information for that, as well as my before and after and Josy's before and afters. We will post some from the company. We try not to use company before and after, vendor before and afters as much as possible. We like you to see real people, real clients. So we'll post some of those as well.
I've been doing this med spa stuff for forever.
Yes.
Like, you guys know I know my stuff.
Yep. I love when my patients know their stuff. It's the best.
I sat down with Rochelle, and the first thing she was like skin this is a journey, right? We're going to be chipping at whatever problem areas that you want to work on until you're happy with the results. And that's when I knew that she wasn't trying to sell me some magic solution or like one and done fake treatment. No, she sat me down and set expectations and went through the whole process and explained in a way that gave me confidence, because it's kind of scary having a laser on your face.
Sure.
Or needles coming at you. But I felt really comfortable the whole time because I knew that from the get-go she was honest about what was going to happen and what to expect. So I felt very, very comfortable with it. So yeah, that's how I knew.
I'm excited, guys. Josy, I'm excited for your next one. I cannot believe just how gorgeous your skin looks. We have loved having you in the Affinity family. You're such a great representation for our spa too, with your gorgeous skin. Thanks for trusting us and letting us take care of your skin. And thanks for joining us on our call today. You'll have a great rest of your day. Stay beautiful and be well.